That's the cool thing about amino acids is, as you mentioned, a lot of times, when we pitch people our services, we're like, hey, sign up, give us a call, evanbrand.com, justinhealth.com. People they have to have enough motivation or have to be miserable enough to do that. And sometimes I don't even think people, and they know they want the help, but I don't even think they have enough motivation to even call us and reach out to us. So if you're one of those people, we're here. But in the meantime, yeah, maybe you use a little bit of tyrosine to get you motivated enough to even reach out to get further help. Because I think a lot of people get overwhelmed at what it's going to entail in regards to diet changes. Like, oh, that's overwhelming. You're going to make me cut this out. And lifestyle changes. You're going to make me cut that out. Like, oh my God. Or now I got to go to bed at 9 o'clock. That's too hard. So we use these little tools, these functional medicine tools, to help motivate people to get them through the protocol, because you and I could design a perfect protocol. Mitochondrial support. We've got the gut dialed in. We've got the detox, the binders. We've got the liver, the gallbladder, the adrenals. It's all taken care of, but it's only if somebody follows through. So then you get to the part of compliance, which we could do part 2 on that if you want. Like, how do you stay on track? But making the plan and getting the labs is the first step, and then getting people to follow through is the second one. I think
Yeah.
progress ultimately gets people going because they'll feel how much better they are, but sometimes we'll use some of these brain nutrients just to give them the oomph to get through and follow through.
Yeah, and like from a mindset perspective, it's kind of like if you ever pushed a car before, right? You push a car, the hardest thing with pushing a car is overcoming the initial inertia of the car not moving to moving, right? So that's the hardest part. And so when we're dealing with people's health inertia, it's just getting a couple of habits moving in the direction that allows the car to start moving. Now, the amount of energy you need to put into that car to keep it moving is far less, right? It's far less because you overcome that initial inertia of it being stuck to moving. And so that's kind of what health is. You kind of make a couple of small changes. Now the ball's rolling. And then now you can add, you can just tweak the sleep a little bit, add a little bit of movement in there, add a couple of supplements. And now we have a lot more momentum, and it becomes even easier to keep that going. And then, of course, the key is now, okay, all the energy going into it, we're moving through the 4 steps of learning, right? It's unconscious, uncompetence. You don't know what you don't know what you don't know. Now you're consciously uncompetent. You know what you don't know. You're at least aware of these things. And then you go from step 2 to step 3, where you're consciously competent. Someone's helping you, but it's a lot of energy to keep doing the right things. And then ideally, you start to move into the level of unconscious competence where it's automatic, right? It's like someone who drives a standard transmission. Everyone who's done that, they know, like, they're starting off, they're like clutch, shift, what? Their head's going down, looking at the gearbox, they're up. It's tough, right? But then eventually it's like clutch, shift, 1, 2, 3, right? It's easy. Downshift, no problem. You don't have to worry about it. It's like you're an automatic transmission because you get the whole thing. So that's kind of what a lot of these habits are, is you just start with the ones that really bear the most fruit, and then you go up from there. And so that's kind of how I look at it out of the gates.
Well, look, you just did it live on camera because you're like, oh, well, here we are talking about boosting the brain, and then boom, you whip out a capsule, and boom, you pop your aminos just like that. So, I mean, that's kind of how I am too with protocol. I mean, I'll just feel how I am. Oh, I need a little bit of this, a little bit of that. And I'm just constantly making these micro calculations throughout the day. Oh, little low here. I'm going to hit this. Oh, stressful day. Hit the adrenals a little harder. Oop, moldy building. Hit the binders. So we're constantly making these tweaks, and it's just a really good place to be.